Good afternoon. This is Dr. Larry Kidd tuning in from Henry Mayo Newhall Hospital here in Valencia, California. Thank you all for joining us once again. Dr. Bud Lawrence, Medical Director for the Emergency Department, is here with me again today, and we'll be addressing some questions that you've submitted. The first question that I'll be addressing has to do with whether or not we have dress code or appropriate attire and mask, and specifically someone asked about, for example, what about the housekeeping staff? So currently we have policies and procedures related to PPE, which is personal protective equipment, as we've discussed in the past. The dress code related to PPE has to do with the directions from the CDC, as well as we consult with various other experts in the field. We actually have infection preventionists on staff. Previously, one of our infectious disease physicians was here on Facebook Live presenting from medical director perspective. And then also we have nurses who are also infectious disease specialists in the hospital. So with that, depending on whether you are a direct caregiver providing care directly to a patient, there are specific PPE that are provided as a guideline, as well as those individuals who are supportive of the clinical team. So for example, housekeeping who would be cleaning a general area outside of a patient's room, for example, would have a certain attire, but should they have to clean a room, for example, where we may have treated an infectious disease patient, they would have an additional PPE that would be required, which would include a mask and various other types of equipment. We also happen to have a device in our hospital which we put in rooms after a patient who has had an infectious process in place, where we actually can disinfect the room, including all of the equipment in that room, as well as including all the surfaces in the room. So currently, just to add, we do have an adequate supply of PPE for all of our staff, and fortunately, we continue to be able to provide what is needed for patient care and for those who support the environment, such as housekeepers. So thank you for that question. Dr. Lawrence has the next question.
Hello, good afternoon. So the next question actually is less of a question, but more of a statement actually that we've kind of noticed. And as we're kind of getting into the COVID-19 life set that we've all sort of unfortunately become used to over the past couple of weeks, everyone's doing a very good job of staying home from what I've seen. And if we could all continue doing that, that's been making a big impact, I think, on the infection in our community and managing that. One thing I just wanted to remind everybody is that we have noticed a decrease in volume, a significant decrease in volume in our emergency department, which is a sign that everyone is doing what they've been told. They've all been staying home, which is a very good thing. But what I just want to remind people is that we are still open. We are here for you to take care of you if you're having a health concern that you're worried about. Obviously, I think many people have said, well, I don't want to go to my doctor, I don't want to go to an urgent care, I don't want to go to the ER, I'm just going to kind of ride this out. Many times that's probably okay. I just want to put a point of reference out there for you to know that we're here. Our job is to care for our community. Our emergency room is set up so that patients who screen positive, first off, they're screened outside the emergency department, and then if they screen positive for possible COVID-19 or coronavirus, we are trying to manage our patients that do screen positive outside the four walls of the emergency department. It provides essentially a layer of safety for our staff and our other patients inside, while still being able to provide the best care available for our potential COVID-19 patients. That's why we have drive-through testing station. But that also means that that ideally the inside of the emergency department is more of a clean place in terms of COVID-19 infection. So I just don't, well, I guess the point is I don't want you to be at home with chest pain and be so concerned about coming to the emergency department because you don't want to catch a virus that you end up having a worse outcome because you never sought help. Just to kind of reinforce that we are here for you, and if you need us, come by and we'll be happy to take care of you.
Right, and just to underscore what Dr. Lawrence just said is the fact that we are still a full-service hospital. We're providing all the services that we normally would, and if you do have an acute need, if you have a medical urgency, then we are still available for you, and we encourage you not to delay care. If you have an acute situation, you do want to take care of that early on as opposed to delaying, which could prolong the recovery or potentially have a more significant impact on your outcome if you wait too long.
Exactly.
We have a question related to individuals that might be shopping in the local grocery store and whether or not it is necessary to wipe down all of your containers that the products come in, that sort of thing. Generally, as a rule of thumb, by practicing the recommendations of the CDC, social distancing while you're in the grocery store, to ensure that when you do purchase whatever the groceries are that you purchase, vegetables, what have you, you want to exercise the same caution as you would any other time. So you want to wash those products. It's certainly advisable to wipe down containers if you're taking your own bags to the store. That sort of thing is recommended generally, not just during the COVID-19 period, but also generally to wipe those bags down because you could pick up other things. And then, as we always emphasize, these are your weapons of mass destruction against the COVID-19 virus and any other infectious disease. Hand washing, hand washing, hand washing. So before and after handling any food products, washing your hands is the best defense to make sure that you don't contaminate what you're going to be eating.
It's great advice. I mean, hand washing, please. Such an important part of everything. So here's a question. Is there a risk of spending time with my 7-year-old grandchild if he and I have no symptoms and are not sick? So this is a great question, and I don't know that we have the perfect answer for this. Sometimes patients can be sick with COVID-19 and perhaps not show symptoms is sort of the data that we're coming back with at this point. And keep in mind, everything I tell you is evolving, and I might tell you something today that might change a week from now or after when there's more data. But for the most part, I think it's probably not a high-risk situation. However, I would say to you that it's probably not worth it at this point. I have kids. My kids have grandparents, and we've sort of just said, even though we're all healthy, probably the best thing is to stay away at this point. If just for the short term, give it a few weeks, or perhaps even a little longer if necessary. I would recommend using things like FaceTime. I think you may see on the video, on the news, maybe people are using Ring doorbells. FaceTime is probably the best idea, or Skype, something along those lines. You can still have a face-to-face interaction. It's not the same as grandparents playing games with their kids and watching movies together, but it is definitely something, and I do know how much that personal connection means to people, but just for the time being, perhaps I would probably stand down with those types of things.
I have a question, a follow-up from the last guest, Dr. Han, who is an OBGYN that was with us on last week, and it has to do with a policy around allowing a support person during L&D. So an individual who is going to be delivering their baby here shortly, I guess, wanted to know whether or not they would be able to have a support person, a coach, with them during that time. Our policy generally is we evaluate on a case-by-case basis. We do have a fairly strict visiting policy currently that we only allow visitors under specific circumstances The delivery of a baby would be one of those circumstances. With all of our visitors and our employees on a daily basis, we do a screening. So we would want to assess the individual that would be the support person for the mom that's delivering. And based on that, we would determine if it's appropriate. So certainly there's an arrangement and a review of the plan before that delivery occurs, so that we know who it is that's expected to be with that mom. But it's on a case-by-case basis at this time. But we do understand the need for having a significant person with you during the delivery of your baby.
And I just want to touch upon one thing that came up as a question is, why are we seeing maybe more positive tests that are being reported? So if you look online or you watch the news, maybe you've seen, I think today perhaps our count is maybe 38 or 39 patients in the Santa Cruz Valley that have tested positive for COVID-19. I think obviously our facility has not tested all those patients. Some of these people perhaps get tested outside the valley, perhaps at their work, if they work at other hospitals, things like that. I think part of the reason why we're seeing an increasing number of positive tests is, number one, time is passing. The disease is, the COVID-19 is sort of, as we've seen in other countries and states, sort of working its way through its course. And I think that we are also seeing more positives because we really are only testing high-risk patients. So patients that are going to be admitted to the hospital, for example, or healthcare workers. I think that at this point, everyone kind of understands this is in the United States and certainly in our community. So, which is why staying at home is making such a big difference. If you stay home and didn't leave your house, which sounds pretty boring, you'd never get this illness. So I think it's really making a big impact, but we also really need to reserve our testing for those really critically sick patients so that we have appropriate turnaround times on the test and that we can make good medical decisions when necessary. So I think that's an important piece. Please don't be disappointed if you come to the emergency room to be tested and the physician or provider tells you that you likely have COVID-19 and to kind of home isolate, because for the vast majority of patients, your course of illness is going to be very mild, and that is absolutely appropriate instructions.
Thank you, Dr. Lawrence. We've had an outpouring of support. We've requested support from this community for our blood drive that's actually coming up this week. And we're pleased to say, based on your response, we have filled all of our slots. We have all of the donation slots filled for this week, and we so appreciate the responsiveness of this community. While our slots are filled for this week, we do encourage you to still go to the Red Cross website. Please. Because there are so many other areas that are not meeting their quota in terms of their blood drives, and they do need your support. And given that the blood given at those sites may or may not be needed there, it's a potential that we will need some of that blood here at some point. So we're all in this together in terms of improving the nation's blood supply. We will be announcing further blood drives here later, but at this time, please go to the Red Cross and consider donating. But thank you for your generous contributions and donating to the blood donation site here at Henry Mayo.
Thank you guys for all of your great questions. Please leave more questions in the comments and we'd be happy to try to address them on a later Facebook Live. We appreciate you tuning in, and listening to what we have to say. I think it's an important part of educating the community, and I hope you guys stay safe, stay well, stay at home, and if you need us, your local hospital's here for you. Have a good afternoon.
Thank you very much, and thank you for tuning in. We will see you soon. Stay safe.